Well, you know, it's interesting. When we first began the work on MyHealth Access Network, which really at the time was called the Greater Tulsa Health Access Network, we had spent 6 or 7 months meeting with leaders in the healthcare community and the business community, asking them what, you know, showing them our terrible health outcomes and asking them what would they want to do to improve that. What could we do together? And that led up to an important moment in 2009 where the mayor hosted a summit on health in our region. The Tulsa mayor did. And we had about 70 people in attendance, the most, you know, all the healthcare leaders from the region who had been participating in the discussions up to that point and some who had not. And we reviewed our really just atrocious health outcomes as a region and agreed that we needed to get together and work together to try and address this issue. And so we launched at that point the Greater Tulsa Health Access Network. We all signed a charter, and we began a 100-day planning process where we spent, it was close to 400 people by the end of the planning process. We spent 6 hours a week together in a room planning in the mayor's headquarters. And at the end of that 100-day process, we had a strategic plan for our community. And I always say that, you know, it may have been possible to go to another health information exchange and pull down their plan and even their technology off the shelf and say this is what we're going to do. But I think that what occurred in that 100 days and has occurred since was a critical component of building a health information organization, and that was the relationship building, the process of building trust between people who are sitting across the table and next to one another who are competitors with one another, people, you know, from the payer side and the provider side sitting at the table, you know, describing what their biggest problems were with the way the system worked today and having them come to a shared agreement on what needed to happen. We actually had to build a culture of working together, and so that really was the point, at the conclusion of that planning process and at the point where the Beacon opportunity was released and described, you know, a program that was seeking the most audacious goals for improving health in a community. And then we looked down at the plan we had created and we said, this is that goal. And that's what led us to apply for the Beacon Award. And I will say that the Beacon program has had a major impact in this community. I think we could have achieved everything we laid out in this vision without Beacon, but it would have taken many more years and quite a bit more policy change to get there. With the Beacon program, we've been able to, you know, put our foot on the gas pedal and accelerate this program into something that's reality today.